assess the criticality of that patient, and this will be done with the help of this class. So first, coming to the definition, how many of you have heard this name triage, or whether you have seen this written in anywhere in any type of hospital? Anyone have a quick response? किसने देखा है ये ट्राइएज शब्द? अभी किसी के दिमाग में आया है? प्रणव?
यस सर,
आईजीआईएमएस में कहीं पे लिखा होता है? कहाँ पे लिखा होता है?
सर, इमरजेंसी गेट के जस्ट बगल में है।
बगल में लिखा होता है। उसका कोई उसका अलग रास्ता होता है, या जहाँ पे रजिस्ट्रेशन हम कराते हैं वहीं से होता है? सामने वाले गेट में है कि साइड में? साइड में है। कभी
मतलब
किया है आपने?
इमरजेंसी के बगल में ही है सर, मतलब कि रजिस्ट्रेशन काउंटर के तो बगल।
ओके, सो आई थिंक आप समझ गए होंगे कि मैं क्या बात करना चाह रहा हूँ इस बेसिस पे। एंड दिस इज ट्राइएज। ओके, हम लोग ट्राइएज के बारे में आज पूरा चर्चा करेंगे, एंड दिस इज द बैकबोन ऑफ दिस क्लास. So just I am reading the definition and then I will explain. This is the art of assigning priority to emergency patients and their problem based on rapid assessment of historical and physical parameter. अभी बहुत सारे physical parameter आप अपने PPT पे देख रहे हैं. Mucous membrane, capillary refill time, heart rate, pulse rate, consciousness, pain. So these are certain points. As a clinician, you have to judge and you have to prioritize the patient. Suppose there is a big queue of patient and you are in OPD and you are looking after the case, and a owner come to you that, doctor, please see my dog, please see my animal first. The owner will, because this is not a human patient, he will not come with an ambulance and with a light and with a siren. He will come, the owner will come to you and explain to you, or he can ring to you that my dog is showing or my animal is showing such type of symptoms. Now it's your job, or the experts that is posted in such type of unit, they are well works with different situation of emergency patient. They have the role to judge the patient. You have to judge within a few seconds and few minutes. Otherwise, you may delay or you may prolong the procedure of examination. So on that basis, on a very few points, you have to judge the patient whether they are really critically ill. Now this procedure or this art of judging the patient that this patient is suffering from such type of emergency problem is called a triage. And this is done on the basis of different small parameters. You are not going to administer ultrasonography. You are not going to collect blood from them. You are not going to collect, do for X-ray. This procedure are avoided in case of triage. Just on the basis of few physical parameters, just on the basis of observation, and just on the basis of a capsule history. A capsule history is very important. You see the term called a capsule history is very important. Just the owner will tell, oh, my dog has taken this, take a rodenticide, or is one on the heat stress, has just gone outside of home. And then only a few clues can give you an indication that this is a serious patient and it has to be separated from the normal one. So the art of separation of the patient from the normal one and giving attention immediately to it is called a triage. It's okay to all of you? आपने triage समझा? अगर आपके पास 10 पेशेंट लाइन में हैं, उसमें से एक ऑनर कंप्लेन करता है, डॉक्टर साहब मेरे गाय को, मेरे डॉग को देख लीजिए, ये थोड़ा सा मुश्किल में है, सांस लेने में दिक्कत हो सकता है, ब्लीडिंग डिसऑर्डर आ सकता है, ब्लोटिंग कंडीशन आ सकता है, ये कुछ भी एक दो कंप्लेन आपको बताएगा. उस बेसिस से आप वहां से उठेंगे और आप नॉर्मल पेशेंट को छोड़ देंगे और छोड़ करके उस पेशेंट को देखना आपका पहला प्रायोरिटी होगा. सो बोथ वे, फर्स्ट इज द आर्ट ऑफ असेसिंग, and sometimes the owner even not able to appreciate whether the dog is serious or not. So within a few minutes you can judge, no, this is not a serious condition, you can wait for a minute, I will see in a queue. So this is the art of a triage, and this is the real method. Now from where this triage term come? Ye triage kahan se aaya? Now this is really a military term. During World War and during the European War, this is arrived from a French word called trier. It means to sort out, means you have to sort out the patient that is really critically ill. So this method is derived from a French word called trier. It means you have to sort out the patient from the normal one. So this is triage. Trier is means to sort out. And the very important term, some of you might is very well versed. I think I am very proud that few of my students are really doing well, and I appreciate their approach towards the cardiology. I'm really because of you, I am reading more and more in ECG and reading more in echocardiography and also in different diseases of heart, because in our syllabus only we have to deal with few problems because we are not specialized in cardiology. So, but I am reading that. So one term is very, very important in human triage. It's called the golden hours. And now we have to adopt from the humans whether this golden hour can work in our situation also or not. गोल्डन आवर के बारे में आपने सुना होगा कि अगर किसी को सुना होगा कि अभी वो हॉस्पिटलाइज हुआ है, आईसीयू में गया है, सीसीयू में गया है, नाउ उस समय बात करेंगे कि उसका गोल्डन आवर पीरियड निकल गया. Now what is that golden hour period? Even in case of cardiac arrest and infarction, the people say that you have lost your golden hour. First you get hospitalized in ICU during the golden hour. In that condition, the percentage of survivability of the patient is very, very high when the patient is admitted in the golden hour. The two very important things in case of triage. The first, you have to sort out the patient, and second, the golden hour, judgment of a golden hour. If the patient is shifted to the ICU or given different types of ventilation or given CPR, different types of method, then you can able to save few of the patient that is really suffering from different types of emergency conditions. Okay, so we have to adopt, we have to take something from human medicine. So the new term come here that is called ATT. So this ATT is Animal Trauma Triage Scoring System. I'm all talking everything. We have to establish, if we want to make a very, very good hospital, we have to establish all these things. Just I am giving you a lecture, but our role, our basic aim, and on that basis aim, we have started a small critical unit, but it needs more functioning, more strengthening. And this is based on this theory that there should be, just like a trauma center in human being, the animals should have ATT, Animal Trauma Triage Scoring System. So we have to score. I have one paper I can give you. I can share with you. There is the detailed scoring system in this. So the second term after ATT is Apple. Now, just why I am calling this new term, because they are very, very new to me also and you also, and you have to adopt in your regular practice, not only for academic point of view, but for a very, very important critical situation. The ATT is Animal Trauma Triage Scoring System, and second is Apple. Now, this is not the Apple that the Apple mobile on the Apple what we eat. It has something. Now, anyone can tell me what is called this method when we use to remember a big terminology, a big definition by a small abbreviation like Apple? Can you tell me there is a terminology in English? This method
Mnemonics.
Mnemonics. Very, very good. So these are all mnemonics. Just by making a mnemonics, we will able to appreciate this term anytime. Sometime you may forget. Yeah, you just remember ATT. You will understand ATT, but you will not be able to pronunciate Animal Trauma Triage Scoring System. Similarly, now it is very difficult to remember acute patient physiological laboratory evaluation score. Such a big term is there. So in short form, we will tell Apple. So Apple is acute patient physiological laboratory evaluation score. So this is the secondary survey, because when a patient came to you in a grave situation, you have to adopt ATT method, not the Apple method. Apple is the second time. Suppose a patient, a owner came to you with a history of a shock of a patient. You just ask a capsule question. You just monitor the mucous membrane. You just do the preliminary examination. Do not go for taking blood that I will examine whole blood. Whole CBC will be done. Then the patient will wait, and then you will start the treatment. You have to start the treatment to save the life of the patient, and then followed by even the questionnaire. There is a two method of asking a questionnaire in this. First, a capsule question by a main clinician. Then you start the treatment and then send any attendant or a paper to to the owner that is sitting in the other room, do not allow the patient to enter into CCU with the patient. Otherwise, there will be a great difficulty and you have to take a signature from the patient owner because parents, because there is always a chance of mortality in critical care patient. So said that paper need to be signed before taking the patient, just a small paper. लेकिन आपने एक सिनेमा देखा है, मैंने भी देखा है, जिसमें वो कौन सा सिनेमा है जिसमें बोलता है कि मैं पर्ची भराऊं या फिर जाकर के आईसीयू में भर्ती करूं. अभी इसका कोई पता है? 3 Idiots.
लगे रहो मुन्ना भाई.
मुन्ना भाई, मैं तो वो उसका ही याद कर रहा था. लगे रहो मुन्ना भाई में बोलता है यार मैं कितना अच्छा डायल. वेरी गुड. मैं उसको यहाँ पे कोरिलेट कर रहा हूँ. वो ट्राइएज कर रहा था. सोचो वो कम पढ़ा लिखा डॉक्टर था, लेकिन आप देख रहे हैं कि उसका ट्राइएज सिस्टम कितना अच्छा था. वो झपकी भी लगाता था. तो दैट इज ऑल ए ट्राइएज. उसको नॉलेज था कि भैया फार्म भरने में जानवर, ये एनिमल, ह्यूमन बीइंग मर जाएंगे, इसलिए अभी डायरेक्टली आप इसको वेट नहीं कर सकते. इसीलिए मैंने शुरुआत में ही क्वेश्चन पूछा कि अगर आप IGIMS या कोई ऐसे हॉस्पिटल को जाते हैं, बड़े हॉस्पिटल को, जहां पे मेन एंट्री से अलग में एक एंट्री बना होता है ट्राइएज पेशेंट के लिए, इमरजेंसी पेशेंट के लिए, ताकि उसको भीड़ में नहीं जाना पड़े, उसका एक सेपरेट रास्ता हो जहां पे वो आए और उस पे इमीडिएट वहां पे अटेंशन जाए, वहां पे इमीडिएट उसका इवैल्यूएशन हो और शिफ्ट कर दिया जाए डायरेक्टली आईसीयू में. So this is the method. अब वहां पे आप 50 पर्चा भराने लगेंगे तो वो that animal may collapse. So this is one of the theory behind this Apple and ATT. So Apple is done later on. आप कुछ देर के बाद the patient आपका stabilization में जा रहा है, then you can adopt Apple. Then you can collect blood. Then you can do this type so many investigations. So that is the later part of the this triage system. So this Apple score required blood results, so it cannot be performed in a very early manner. जैसे ही आप आता है animal, आप उसको Apple नहीं करेंगे, you will adopt an ATT, that is animal trauma triage scoring system. And this system is based on so many things, especially the six very important criteria on which we can score the ATT. And this is perfusion, cardiac examination or evaluation, respiratory evaluation, eye, muscle and integument system, the skeletal system, and the neurological system. So there is a score starting from 0 to 3. For example, I take an example of perfusion. So in perfusion, what you will see, you can see the mucous membrane, okay? You can see the capillary refill time, the very important one. Now, can you tell me what is the capillary refill time in general patients in any normal animal? CRT?
Less than 2 seconds.
2 seconds.
Yes,
Two
very
seconds.
good.
Less than 2
Less
seconds.
than 2 seconds or 1 second, you can tell me. So how you will score? This is up to the clinician. So if overall score come more than 18, the survivability percentage of that patient is very low. आपने इमीडिएटली परफ्यूजन देखा, म्यूकस मेम्ब्रेन देखा, आपने म्यूकस का कलर देखा, आप सीआरटी कर लिए और उसके बेसिस पे आपने परफ्यूजन का स्कोर कर लिया 3. ओके, 3 ऑन द बेसिस. अगर सीआरटी 2 से ज्यादा, 3 से ज्यादा आ रहा है, म्यूकस मेम्ब्रेन ब्लेंच दिख रहा है, व्हाइटिश दिख रहा है, साइनोटिक दिख रहा है, उसको 3 देंगे. अगर पिंकिश दिख रहा है उसको 0 देंगे. नाउ ऑन दैट 0 to 3 वेरिएशंस में हम वहां पे पॉइंट डाल लेते हैं. इसका भी आप दिमाग में डालेंगे, ऐसा नहीं कि आप पूरा फॉर्म भराने लगेंगे कि परफ्यूजन का 2 हुआ, कार्डियक का 3 हुआ, इसका ऐसे करने लगेंगे, then an animal will be collapsed. Thus you have to keep in mind the 6 point of ATT scoring system, and then you proceed within 2 to 3 minutes. You have to complete all the procedure. Now coming to the cardiac, you know the pulse we have discussed about. You measure the pulse, the character of the pulse. I will come how the character of the pulse is very important. The rhythm of the pulse and a strong bounding pulse or the feeble pulse. On that basis we can score. And the most important one is the pulse deficit, what we have talked. For pulse deficit, for every heartbeat there should be one peripheral pulse. So if there is a deficiency in that, it indicates certain grave situations. Now coming to the respiration, we know the type of respiration, the depth of the respiration, the rate of the respiration. So this will also indicate early that this animal is suffering from such type of is gasping, open mouth breathing. So you have to just examine. So on basis, you have to score either 0, 1, 2, and 3 arbitrarily. Now the eye and the muscle. Sometimes the animal came to you yesterday only. One situation come when a dog brought in the clinic and it was jumping. Just 2, 3. It was showing a staggering gait. It was showing a heavy muscular movement. So it may be in seizure. It may be showing a fasciculation of any muscular region. Or there may be some abrasion because some accidental case may be there. So there may be breakage in the integumentary system. So on that basis, or the animal may be in severe pain. So on that basis, again, you will score 0, 1, 2, 3. Now we're coming to a skeletal. Although a skeleton, you have to see the bone, different bones. Generally, this is especially important in trauma patient, when the patient or in accidental cases, the road accident is there. So whether you have to see whether the bone is fractured just by physical examination. Don't go for it, and you have to see, don't go for X-ray. That when I will see the case, then I will start the treatment. So a skeleton, whether the bone has come out from the integumentary system, or whether it is a simple fracture or a compound fracture, on that basis you can score. Then neurological examination is very, very important. The alertness of the patient, whether the patient is responding to the honor, or whether the patient is not responding to the order, or showing a aggression behavior.